Ethnic rhinoplasty, it's a general term for all different ethnicities. Essentially, all different ethnicities have different types of noses. When each person comes in and says, hey, they want to actually have a more refined nose, it's not a one-size-fits-all deal. You got to really keep their ethnicity in mind, but at the same time, try to achieve their goals. So I think it's really important for not all my patients to be walking out with the same nose. My special technique is using the patient's own tissues. And a lot of times other people will use silicone implants. I've seen a lot of complications as a result of that, from infection or the implant coming out of someone's nose. And so the gold standard in these procedures is using your own cartilage. It's your own body tissue, so it'll last the longest. It has the least risk. Although it is more invasive at the time of the procedure, at the end it's what gives you the best results with the rhinoplasty. This procedure takes anywhere from 4 to 6 hours, depending on what we need to do. Some ethnicities come in with a really flat nose, and so in order to build that up, we sometimes have to take graft from the rib, and so that makes it a more entailed, invasive procedure. The results of this procedure are very transformative. Ever since childhood, these patients are looking at their noses, and that's what sticks out to them, and they feel like they don't fit in, or they just feel ugly, and that's basically the centerpiece of their faces. And so I take their ethnicity into account, I take their face into account, and I want to create the most natural fit to their faces. And so when they're able to see that natural, better looking nose on them, they're amazed. They can't stop looking in the mirror. And that's what I find extremely satisfying about this procedure.